Hello everyone, I hope you all are doing fine. This is Dr. Sharad Bedi. I am a consultant physician and a diabetologist based at Gurgaon. So today's point of discussion is very important and is very relevant in our day-to-day practice because this is one of the commonest symptoms with which a patient presents to us, and that is tingling and numbness, which are actually associated with the one of the important body parts, that is a nerve. Now, that dysfunction of the nerve can be temporary or permanent damage, which leads to a term called as neuropathy. It means the dysfunction of the nerve. Now, this neuropathy can be either sensory or can be motor. So, to understand this point, it is very important because the symptoms will be like this. So, sensory symptoms like can be tingling, a kind of tingling sensation, and numbness, that is no sensation. So tingling sensation, numbness kind of feeling, heat sensation, or feeling like walking on cotton wool. So these are some of the sensory symptoms which can be due to dysfunction of the nerves. So motor symptoms can be like loss of power in the hands or in the legs, like slipping of chappal is a typical example of motor symptom. Patients do encounter these types of problems. So just to understand, brain is the master organ, and along with spinal cord, it controls the functions of the body. So there are certain nerves which originate from brain and spinal cord, and they travel through whole of the body, even to the tip of the fingers and the foot, and they supply there and help in functioning of the sensory as well as motor functions of the body. So any injury at any of these levels, starting from brain to the tip of the nerve, can lead to symptoms of neuropathy. So if there is sudden problem in the brain which is affecting these functions, it could be a kind of stroke, which is a kind of life-threatening emergency, and one has to visit the emergency on urgent basis for further management. The second is there can be some problem in the nerve. The most common ones I am mentioning here, one is vitamin B12 deficiency, diabetic neuropathy, and some of the autoimmune conditions like vasculitis, SLE, rheumatoid arthritis, and Raynaud's disease. The other most important reason for this is that there is some compression by the outside structure which is outside the nerve. So any of the body structure can compress the nerve, which can impair the nerve's function. So typical examples are carpal tunnel syndrome. I will discuss them one by one, but before that, clinically, how we come to a diagnosis that this patient may be having neuropathy-like symptoms. So one is taking a good history. That is somebody presenting with a tingling, numbness, or maybe slipping of chappal from the legs. These are classical symptoms. We also see whether the pain is more in the morning or in the night hours. Plus, some of the tests can be done in this. Simple blood test could be checking the vitamin B12 levels, checking the sugars, as well as thyroid. And one of the classical tests which we do in this is NCV studies. Now, what is this NCV studies? NCV studies, the full form is nerve conduction velocity studies, in which we see the function of the nerve in terms of its quantitative damage as well as to which area it is affecting. Like typical example is somebody giving symptoms in the hands, then we can do NCV study of both the hands and then see whether the damage is more on one side or the other side, or it is a symmetrical damage. So I will be discussing here only the common causes, not the uncommon causes. One of the commonest causes is B12 deficiency. This is more relevant in our part of the world. Now why so? Because vitamin B12 is actually a vitamin of the nerves. That is very vital for nerve function. But the problem is it is mostly in animal products, dairy products. So somebody who is a vegetarian or a vegan, to add on to that, they are more prone to get B12 deficiency because their diet is not able to sufficiently supply B12 in it. So B12 deficiency is common, and we can simply get the B12 lab test done and find out the levels, and we can supplement B12 accordingly. So B12 is mostly available as a capsule or a tablet and injections. So it depends upon person to person. Those who are okay with it, with the tablet, they can take tablets. Those who wish to get 3 or 4 shots of the injections, they can go for that. Other common cause which we find it in our day-to-day practice is the diabetes. So that is the diabetic neuropathy. So somebody who has a diabetes which is long-standing, one. Secondly, poorly controlled over the past 5 to 7 or maybe 10 years, they are more prone to get diabetic neuropathy, which typically presents like a glove and stalk kind of phenomena. That is a glove and a stalk kind of phenomena, in which it will start from the periphery and go towards the body. Similarly, it will start from the foot and may proceed towards the knee. No, that is why it is called as glove and stalk kind of phenomena. It is generally symmetrical in nature because diabetes is a kind of disease of the body. So it will affect both the hands and legs naturally rather than one hand or one leg, until unless there may be some associated condition along with that. So it more affects the legs as compared to hands, and it more affects at night. Now the point here is that we should get the glycemic control as good as possible to minimize this, one. Secondly, if there is associated B12 deficiency, we should correct it also. Plus, another thing is that now sometimes the damage what has happened to the nerves is actually irreversible. But yes, I cannot change the body, I cannot change the pathology inside, but there are certain group of medicines which can be given which will suppress these symptoms and give symptomatic relief to the patient. I'm just mentioning the short names here like pregabalin, gabapentin, duloxetine, amitriptyline, nortriptyline. These are the common ones used, are safer in the long run and have been recommended by most of the guidelines. So these can be started based on how the patient's symptoms are. Other common condition is autoimmune set of diseases in which there can be SLE, vasculitis, rheumatoid arthritis and Raynaud's disease. These can affect the nerve functions and are generally dealt by the rheumatologist, right? So those who are suffering from this disease, in case they develop some symptoms, do mention this complaint to your rheumatologist because they will be able to find a solution for you. One of the important surgical cause here is, this is very important. One is the carpal tunnel syndrome, cubital tunnel syndrome, and the cervical spine disorders. Just to start with carpal tunnel syndrome, what happens? So here is a tunnel known as carpal tunnel through which median nerve goes, and it supplies to the thumb area more, right? From here is the cubital tunnel, and from here goes the ulnar nerve, and this is the area of the ulnar nerve. So if there is carpal tunnel syndrome, it will have more of symptoms here. If it is cubital tunnel syndrome, it will have more of symptoms here, ulnar, median, right? So it can affect both, though generally it affects one arm. Because why it would happen in both the arms? It is a kind of local disease, some compression. So it will generally affect either the left or the right hand. So what is the treatment in this? A good physiotherapy, certain medical management, and if nothing works, then surgically releasing the pressure at these points will help in relieving the compression. Sometimes some injections can be tried over the local area, but if they don't work out, then eventually we have to go for surgery, and that works, is generally helpful. Other example is here is the cervical spine disorder. So the nerves originate from here. If there is disc prolapse in this area or the lumbar area or the dorsal area, so it can affect the nerve function leading to neuropathy like symptoms. So cervical spondylosis, cervical disc prolapse, these can affect the nerves which originate from here, and they will affect the nerve function proportionately how much the compression is, right? Other very common reason of neuropathy is chronic alcoholism. So if somebody is taking more than the recommended doses of alcohol on daily basis in more increased frequency, then the chances of somebody getting chronic alcoholism induced neuropathy are very high. So what to do in this? Simply cutting down the alcohol amounts as well as frequency will help in giving relief to this. We should always cross check that this patient may be having certain other problems. We should check his sugar status, thyroid status, the vitamin status as well. So just to summarize, that these tingling, numbness are kind of neuropathy symptoms, right? It can be sensory or motor. It can affect symmetrically or it can affect one part of the body. Most common ones here are B12 deficiency, diabetes, carpal tunnel syndrome, cervical and chronic alcoholism, which are dealt accordingly. NCV studies are very important. Wherever there is doubt or it is asymmetrical or before going for any procedure, NCV studies are generally recommended. It will help in getting a quantitative damage to the nerves. So I hope I am clear in today's discussion.